So my name is Joseph Segalla, and I am pursuing a nursing degree here at Northwest University. So I chose nursing as a major mainly because I had a lot of involvement in the hospital setting when I was younger. I have a genetic blood condition, and so I was just in that setting a lot, and I really appreciated what the nurses did for me and just how they made me feel comfortable. And so that was kind of how I got into wanting to become a nurse and be able to actually kind of give back into that community and be involved in that way. So I've thought about it a lot. I mean, it's really hard to know as you're going through the program. I think I want to go into pediatrics, so I definitely like working with kids and just that's where I was for a long time and really just appreciated what the nurses did. There's so many like different aspects of that I could go into, and that just really excites me, the fact that there's so many opportunities available. Go into public health or go into like nurse practitioner, like so many opportunities. And I think I'm just excited to be on the floor and just work for a couple of years and just kind of get that experience and kind of feel exactly where I want to end up. I'm pretty open. I might end up realizing, man, I really want to work with like mental health patients in, a rural clinic setting. I don't know. So I think that actually, for a lot of people, that's kind of scary. Like, man, there's so many options. Like, I don't know. For me, it's like, wow, there's so many options. Like, I can do a little bit of everything, or I can really find where I feel like I'm equipped and where God's calling me. Being open to see what door, God's asking you to walk through. And maybe it's a lot different than you expect, but realizing that, like, there's so much potential there, and realizing that, like, He's got you no matter what, no matter where you end up. My favorite class so far probably would be our just in-class, like, pharmacology and skills. It's really, those are the things that we're practicing in the hospitals. So like with pharmacology, it's like you're talking about the drugs that you're going to be using, or like how they affect the body and all of those kinds of things. So it's a lot of like really interesting science for me. So I like that aspect of it. And just that's like the real life application part of like when you go into the clinic or when you go into the hospital. So that's really cool. And then the skills lab is really a wonderful place to just be able to practice the things that you're going to be doing in the hospital. So you kind of feel confident when you go in. So when you go into your patient, like, have you done this before? You're like, well, yes, I have. Like, I have done this in the clinical setting, and like, I feel confident about doing that. Whereas if we didn't have that, I feel like going into the hospital, it would be kind of challenging being like, yes, like I theoretically know what's going on, but I've never actually physically practiced doing it. So I think I like that aspect of it. I'm really looking forward to the pediatrics rotation that we do at Seattle Children's, especially because that's like what I want to do. That's my focus. The rotations that we've been doing through the junior year that have been really good. Being on a hospital floor, seeing how the flow of the hospital works, learning how to take care of multiple patients at once. I think that's a really key aspect of what we learn as juniors and continue to practice throughout the senior year. The Kenya trip seems really interesting. Just first of all, haven't been to Africa, but then also just like doing a lot of the outpatient clinic stuff sounds really interesting. Like being in that environment and learning how to do stuff, because they get exposed to a lot, whereas some of the other trips may not have the same kinds of exposure. The trip to Taiwan actually seems really interesting because they have a lot of in-hospital experience, and they get to work in multiple ICUs, so like a neuro ICU, like a cardiac ICU. And so in that trip, like, that sounds really exciting because I think it would push me to really make sure I'm thinking on my feet. Like, really, do I have the skills? Do I feel equipped to deal with these kinds of difficult situations? So with the cohort for like this year particularly, and kind of those experiences, you kind of grow with them throughout that whole process. And there's probably 10 or 15 of us who started freshman year or joined sophomore year. But a lot of the people that we get also apply, for just the nursing program. They've done their prereq somewhere else. And so when you come in your junior year, you meet a lot of new people. Having that is nice because it's like, well, we're not just all, 19, 20-year-olds who are, doing this and have no other life experiences. There's a lot of opportunities to meet new people, but also at the same time, like, you get locked in with those people. And it's an interesting thing because you form groups and you form like peer groups and all of that kind of stuff. And I actually end up living with one of the guys who's also in the nursing program. So it's like we live and breathe, nursing school. And so that's actually been great for us. There's a lot of group projects throughout the nursing program. So you'll end up working with a lot of people that you may not know quite as well, which is pretty cool because it gets you out of your shell and kind of makes you work with different learning styles and different, people and just all of that kind of stuff. So looking into like Northwest nursing program particularly, I mean, you have to understand that it's going to be a lot of work. It's going to be a lot of time. It's going to be, a big dedication in your life. But at the same time, realize that there's a really awesome reward and opportunity available for you at the end. And that's kind of where I'm in the process of that as well. But understand that you need to have a desire to work with people, have a desire to do things that aren't always going to be like exactly what you want to do. There's sometimes where I'm in the hospital, I'm like, I don't want to do this right now, but it's what, the patient needs this. This human being deserves this and needs this to get better or to get to a place where they, can go home, or whatever the case is. So having that servant's heart, I guess, is a big aspect of it. Also, I would encourage, to come check out the school. A lot of people are like, oh, I don't know. I was like, you come spend a day, just walk around, schedule an appointment, and see, hey, can I check out the nursing school? They're more than willing to help you set that up. And you can definitely get a understanding of like what it's gonna entail and just kind of get a feeling of what Northwest is like. And then also just try to shadow a nurse somewhere. I think that really gives you an idea of what the scope of nursing really looks like and kind of gives you an understanding of what your day-to-day would look like as a nurse.